Fluoroquinolones include numerous compounds. In Spain, the most commonly marketed ones are ciprofloxacin, levofloxacin, moxifloxacin, norfloxacin, ofloxacin, and delafloxacin. Other drugs in this group, used in other countries or in specialized clinical settings, include gemifloxacin, 4th generation, lomefloxacin, prulifloxacin, pafloxacin, and 1st generation compounds such as nalidixic acid, now obsolete. Each fluoroquinolone has a particular spectrum, but together they cover most gram-negative bacteria and some gram-positive and atypical organisms. For example, ciprofloxacin and delafloxacin cover Pseudomonas aeruginosa, while moxifloxacin and gemifloxacin have greater activity against anaerobes and gram-positive bacteria. Clinical indications and diseases treated. Fluoroquinolones are used in severe or complicated bacterial infections where a broad-spectrum antibiotic is required, and when other first-line options are not appropriate. Their approved uses mainly include urinary tract infections, complicated cystitis and pyelonephritis, bacterial prostatitis, respiratory infections, community-acquired pneumonia, severe COPD exacerbations, bacterial sinusitis, gastrointestinal infections, bacterial diarrhea such as salmonellosis or cholera, skin and soft tissue infections, cellulitis, complicated abscesses, and bone and joint infections, osteomyelitis, septic arthritis. They have also been used in prophylaxis and treatment of inhalational anthrax and severe disseminated infections. In clinical practice, the appearance of symptoms such as high fever with productive cough, suspected pneumonia, lumbar pain and dysuria, suspected pyelonephritis, or bloody diarrhea, bacterial gastroenteritis, may lead to consideration of a fluoroquinolone, always after microbiological confirmation or knowledge of bacterial susceptibility. Given their risk profile, the use is discouraged in mild or self-limiting infections, e.g., uncomplicated cystitis or acute bronchitis without complications, unless there are no safer alternatives. Known side effects: common, mild to moderate. The most frequent are gastrointestinal disorders, nausea, vomiting, diarrhea, headache, vertigo, insomnia, and skin reactions, mild rashes. These reactions are usually reversible upon discontinuation. They may also cause temporary elevations in liver enzymes or blood glucose, and mild joint pain. Serious, rare but important, regulatory agencies have warned about severe and disabling adverse effects. These include tendinitis and tendon rupture, especially Achilles tendon, which can occur during treatment or even months afterward, also severe myalgia and arthropathy. Another risk is peripheral neuropathy, pain, tingling, weakness in the central nervous system, agitation, anxiety, depression, psychosis, hallucinations, seizures, and memory loss may occur. Sensory disturbances, loss of vision, hearing, smell, and chronic fatigue have also been reported. They can also prolong the quart interval on the electrocardiogram, cardiac risk, or cause hypoglycemia. Because of these risks, it is emphasized to discontinue the drug and seek medical attention at the first signs of tendon pain or swelling, severe joint pain, or new neurological symptoms. In summary, although infrequent, severe adverse effects may be long-lasting or permanent, which is why guidelines recommend reserving fluoroquinolones for serious infections with susceptible bacteria, after evaluating the benefit-risk balance. Never self-medicate, and keep in mind that deaths due to medications rank as the third leading cause. These sources of information come from regulatory agencies and peer-reviewed medical literature, such as the AEMPS.